morning. My name is Stephanie Beck Borden, and I serve on the executive committee of the AMOS project in Gamaliel, Ohio. Nearly 3 years ago, I got the phone call in the middle of the night that everyone dreads. On the way home after visiting with my family, my parents were struck head-on by a car crossing the interstate median. My mother died on the scene, and my father was rushed to the hospital with profound injuries. It was an unspeakably horrible time. My father spent 5 weeks in the surgical intensive care unit. He went on to spend another 6 months in a variety of different healthcare facilities. He was only 55 and had been running his own small business installing garage doors and garage door openers. We all knew that he wouldn't be able to do that work again, but we at least wanted him to have the best chance to at least walk around his own house again one day, to live independently. Just 2.5 months after the accident, we began fighting the insurance company and their assessment of his opportunities and capacity for recovery. Beginning in mid-January, it was nearly a weekly battle with social workers at whatever facility he was in to get him another week's stay. I worked full-time. At that time, I had one small child. My other sister was pregnant with her first child and had a full-time job as well. 2 other siblings lived farther away. In March, it took a call from my father's trauma surgeon to his friend at the insurance company, who was the one making the call about whether he would be allowed to stay at an inpatient physical rehabilitation facility. We'd been getting no, no, no. Finally, because the trauma surgeon called his good friend, he was allowed to go and rehab. He was making significant progress, the kind of progress we'd all been hoping for months. 7 months to the day after that horrific night, my father had to go home. The insurance company was tired of paying for him. Despite the fact that he'd been meeting all of the benchmarks that they set to stay, they decided they were done. Regardless of where this 56-year-old man was in his physical recovery, they were done. They sent him home to rot. They told us it was time to go home and learn how to live the rest of his life as he was. Unable to walk, unable to care for himself, he required 24-hour care and assistance. But insurance wasn't paying for that. They would pay for a nurse to come and draw blood once a week to check his coumadin levels. And they'd send a physical therapist twice a week for 45 minutes. And those visits were limited to 20 per year. The rest was up to us. Oh, and this was while he was paying COBRA, because as a small business owner, he couldn't get insurance because he was a diabetic. My mother, who was working full-time, carried the insurance. So no income, no disability, because they denied him twice. He wasn't really disabled yet. We had to hire an attorney to get that. I grew up in a small farming community where everyone knew us. Fortunately, that community drew together to help us care for our father and to pull off a fundraiser so that my father could continue to access physical therapy after insurance inevitably said they were done paying. And there have been times when my siblings and I were afraid that our dad's medical needs would outstrip his policy and the money that was raised. Will he have to sell the house that he and my mother built with their own hands? The house that we grew up in? Something is seriously wrong when a family in the midst of this profound grief has to gear up for a pitched battle every week just to ensure that our loved one receives the care he needs. Something is profoundly broken in the system when a company can decide when it's time to give up on recuperation and recovery because the person who's been paying into the system for years has suddenly become too great a liability for the bottom line.